This slideshow is an adaptation of Dr. Kim Call's writing on STDs in women, modified to look at STDs in men. But first, a terminology note. In the presentation on women, the terms STI and STD were used interchangeably, and this is common. However, per the CDC, which is Center for Disease Control, STI is more precisely used to refer to an infected state which has not been known to cause symptoms, and STD refers to a state where symptoms have been noted, indicating a disease state. A sexually transmitted disease is contracted by having sex, whether orally, anally, or vaginally. STDs are so frequent, they are second only to the common cold in the U.S., per Dr. Call. Men can contract and transmit all the same infections as women. It may sometimes be easier to see some of these infections in males, such as the sores that can appear on the outside of the penis in syphilis. Both men and women have a discharge when infected. In men, the urethra inside the penis tends to be infected, leading to urethritis, pain and burning on urination, or penile discharge. In both men and women, other areas of the body may be painful and infected if non-vaginal sexual intimacy is pursued. These areas can include the anus, rectum, mouth, or throat. AIDS, caused by the human immunodeficiency virus, HIV, is an STD. It is very dangerous. It can be spread via blood, sexual intercourse, and potentially saliva. See the module on immune and lymphatic system diseases for more on AIDS. Gonorrhea and chlamydia are two very common STDs. Both originate from a bacterium, Chlamydia trachomatis for chlamydia, and Neisseria gonorrhoeae for gonorrhea. Chlamydia is the most common STD in the U.S. Symptoms in men include discharge from the penis and/or burning with urination. However, a large number of men and women are asymptomatic with this infection. Nonetheless, bacteria can still cause damage. Trichomoniasis, or trich, is another common STD. It is caused by a protozoa called Trichomonas vaginalis. You may have a bad-smelling discharge, and your private parts may itch or burn. This is treatable with antibiotics. Despite the species name vaginalis, both men and women can contract this disease. Herpes is caused by a virus, either HSV1 or HSV2. About 1 in every 4 adults has herpes. The first outbreak of herpes may cause painful burning sores on your private parts, as well as leg pain, headaches, and painful urination. About 90% of people have antibodies to one of the herpes viruses, but most infections go away and do not return. Can cause cold sores and genital ulcers. While herpes cannot be cured, if people get frequent outbreaks, they can be put on preventative medication. Human papillomavirus, HPV, or genital warts, can affect the genital, oropharyngeal, or anal regions. There are hundreds of types of HPV. It can lead to cancer of the infected area, but most cases go away on their own. Genital warts may be visible. The FDA has only approved an HPV test for women, but it is highly likely to be transmitted between partners. Hepatitis B and C, caused by viruses abbreviated HBV and HCV, are transmitted via blood products and sex. They can lead to hepatitis, which is inflammation of the liver, and liver cancer. Hepatitis C is curable with an antiviral. Hepatitis B usually goes away but cannot be cured and can become a chronic infection. Syphilis, caused by the bacterium Treponema pallidum, can leave a canker or small painless nodule that disappears in a couple of weeks. If not caught, it can spread to the blood and other organs like the brain. Almost all STDs can be treated or managed with antibiotics or antivirals. Partners should be notified and treated. Condoms are the best way to prevent STDs.